These are some of the most important questions that you can ask the patient in front of you, as important as the red flag or serious pathology questions, because they can have a massive impact on the rest of your assessment and how best you can help them moving forwards. Welcome back to Clinical Communication. Today we are discussing the ICE questions. You may well have heard of these before. Today we're taking a deep dive into these questions, how to ask them, how to manage the answers, and extra things to ask with as well. These questions are really important because the answers you receive will have a big impact on how you're going to manage the later part of your time with that patient in front of you. This will include reassurance you're going to give, discussions you're going to have, treatment you're going to suggest. And patients generally value being asked of their opinion. Okay, they like to be asked what their thoughts are, what their concerns are, their expectations. Occasionally, they don't. Not everyone does. I remember recently I had a group program and the patients actually complained that they were always being asked what their thoughts were. So it may not be the words, but it may be the tone, as we'll come on to later, how or when to ask them. But for now, let's dive into what these questions are and the extra things you may want to ask with them. So the I in the ICE question stands for impressions. You're probably going to ask them, what do you think is going on? What were your thoughts on what's happening here? And then they'll give you a response. They may say, I don't know. They may say, well, I think it's something's broken, or I think I've got an infection, or I think something's torn, or whatever it is. Okay. Sometimes they'll have us an idea, sometimes they won't. If you're seeing someone after they've had other opinions already, a different slant may be to ask, you've seen these people in the past, they suggested this diagnosis, what are your thoughts? And it's just a different way of asking really the same question, but comparing with the information they've been given already and how they feel about the diagnoses they were given. And then from that, they'll give you whatever information or thoughts on their diagnosis they have. And then what you can follow that up with is asking, and what do you think will help? Now, this does merge with the expectations question, but it does kind of fit nicely. It's not mandatory, but they may say, for example, if they think they've got an infection, the classic struggle is, well, I think I need antibiotics, or I, I think something's broken, I need an x-ray, whatever it is. And with all of these answers that you're going to get, not just for the impressions, but the concerns, the expectations, they're going to give their answer. It may be completely in line with what you're thinking. It may be very far away with what you're thinking. But don't immediately, if it's very far away or you think they're wrong, don't immediately say you're wrong or challenge them on it or start an argument. Okay? Just whatever the answers you get, just acknowledge it, repeat back what you've heard, and then come back to it later once you've done your assessment. You're going to let time for any emotions to calm down, to let them feel you've assessed them properly, and then address it. If you immediately come back at them, it turns what is potentially a pleasant, nice conversation into an argument. So the C in the ICE acronym stands for concerns. So you'll probably ask, what concerns do you have? Or I often ask, what's your biggest concern regarding this? And then again, they'll say what concerns they have. They may have an answer, they may have clear concerns coming in. People often say, I'm worried about it's getting worse, worried if I can't get back to my job. People may say, I'm worried I'm going to end up in a wheelchair. Who knows? They'll come out with their concerns. Once they've finished and you've acknowledged it, don't just move on. Ask afterwards, okay, are there any other concerns you have? Why? Because they may not always tell you their biggest concern straight away. They may tell you what they think you want to hear related to what they're seeing you for, but their actual biggest concern may be something very different, or they may feel is unrelated, but could be playing a large part in why they're suffering or why they've come to see you. Here's a simple example from someone I've seen last year. It's a fairly elderly lady. I've seen her in clinic, and I ask her, with her, let's say, persistent pain, what's your biggest concern? And she says, I can't get back to my gardening. And repeat back, acknowledge it. I said, okay. And are there any other concerns you have? And she said, well, yes. I'm worried that I may not be able to drive safely soon because her condition was affecting her legs. So she was worried that if she couldn't operate the pedals properly, she may then have an accident, impact someone innocently, or may be unable to drive, and so lose her independence. So I acknowledged it, repeated it back, asked again, okay, are there any other concerns you have? She said, yeah, well, my children are having more children themselves, so I'm going to have more grandchildren to look after in the future, but I'm worried I may not be able to look after them anymore or be able to look after them safely. She was worried that because of her condition, she wouldn't be able to carry a new child, something may happen, or maybe just be too much demand on her life that she couldn't handle. Acknowledged it, repeated it back, and asked again, okay, any other concerns you have? There's a long pause. She looked down at the floor and then back up at me and said, well, yeah, I'm afraid of dying. And from that discussion we had, it became apparent that her overall health and ability was deteriorating. She was struggling to cope. And as you can see here, her biggest concern was really about much bigger than what she was seeing me for. It was to do with life and just living, which is as if not more important than what we really see our patients for. This is really the benefit of asking them, are there any other concerns? Because it may open up and bring out more information that gives greater light on the situation that the patient in front of you is going through. And the final question you're going to ask is about expectations. Expectations of you and the service. So classic thing I always ask is, what did you want to expect from me or our service from coming to see us today? And they may say, I don't know. They may say medications. They may just say help. Whatever your speciality and profession is, it may be related to that. Of course, what they may want to expect may not be in line with what you do or what's suitable for them. So classic physio one would be, well, I want you to manipulate me for 10 sessions twice a week to solve my 3 years of back pain. And like I said before, don't immediately fight back and tell them why they're wrong, okay, or why they don't need it, or why things are different. Just acknowledge it. Acknowledging it doesn't mean that you are agreeing with them. It just means that you're taking in and you've heard what they've said. You can then address it later. Once you've got that information, jot it down, acknowledge it, and then continue your assessment. Come back to it later after you've finished, as I said earlier. There is no right time to ask officially. It kind of depends how much time you have. I like to get to know my person, ask them lots of questions about their story, about their other medical history, things that make it worse or better, and then come to that later on because I have time, I have an hour. But if you are time limited, may only have 10 or 20 minutes, you may ask it earlier. Of course, what may also happen is they may come out with the answers as you're letting them tell their story. They may tell you that they think they've got this condition or this problem, or that the biggest concern is X, Y, Z, or what they want or expect from you is this. So you can jot it down. If they've said it, you don't have to ask again. But you can maybe ask, were there any other expectations or any other thoughts you had or any other concerns, like I said earlier. Sometimes we also get asked, do you have to ask them in order? But see, the acronym fits because it's a word. Officially, no, you do not have to ask them in order. If, let's say, they come out with the expectations early on and then you just need to ask the I and the C, that's fine. Or if they come out with their impressions first of all, and you just need to ask the concerns and expectations, that's fine. If it just feels natural to do it in a different order with the person in front of you from what you're discussing, it's okay. It's not like your assessment's going to go drastically off track if you ask expectations first instead of impressions. Main thing is you ask all of them. And what impact does this have on this second half of your time with them? Why is it so important? Well, let's start with impressions. If you've asked them what you think is wrong and what they think is going on matches with your thoughts, then you can just say, yeah, you're right. Actually, it is this. You're correct. And if you want to ask if they have any questions about it, then do. But if they have a good understanding, then you can just move on to your treatment suggestions. You don't need to stay on it. If, on the other hand, their impressions are very different to your thoughts and diagnosis, then you can expect more resistance, more questions, more difficulty accepting perhaps. You can get an idea of what mood and how you may want to start phrasing this, or how you want to pitch it to them. If they're concerns, it will advise you what reassurance you need to give, what things you may need to say. If they have lots of concerns, then you may need to go through them and address them before they can then move forwards with their actual treatment. But if they also report no major concerns and just looking for basic advice and guidance, then you can give a small amount of reassurance and then again move on to what you're going to suggest to help them. And then finally, with the expectations, again, if their thoughts and expectations are in line with yours, you can then just crack on with delivering whatever you're going to suggest because they're already bought into it, they're already on board. However, if their expectations are very different to what you can offer or what you're suggesting, then again, you can expect perhaps some resistance or lack of acceptance or just difficulty with that conversation. It doesn't mean you don't still offer or suggest what you want to suggest, but it gives you an idea of how that conversation may go, how on board they may be, things you may need to discuss before they can move forwards. But as I said earlier, these questions should be routine in every assessment you do because they are as important as the red flag or serious pathology questions you may ask as well, because they will have a massive impact on how you assess and then support that person in front of you. Like before, if you found this useful, please do share it with others. Please do contact me and let me know of any questions, guests to get, or topics to cover. I hope you found it useful, and I'll speak to you next time.